You take your B12 every single morning. You think you're doing everything right. But what if that one simple habit is quietly working against you because of something else already sitting in your medicine cabinet? Here's the thing most doctors never tell you. And it's not because they're hiding it. It's because the research on this is newer than most people think. Vitamin B12 is one of the most important nutrients your body needs after 60. It protects your nerves. It keeps your brain sharp. It supports your heart and your energy levels. But certain medications, ones millions of seniors take every single day, can completely destroy your ability to absorb it, not reduce it a little. We're talking about slashing absorption by up to 40%, sometimes more. And the dangerous part is that B12 deficiency doesn't show up overnight. It creeps in slowly over months, sometimes years. By the time you feel the symptoms, the fatigue, the brain fog, the tingling in your hands and feet, real damage may already be done. Now we're going to break down all 3 medications you need to know about. But the one that most people are completely blindsided by, the one that cardiologists themselves are now flagging in clinical studies, is the medication sitting in the nightstand of tens of millions of people over 60, and most of them have no idea it's robbing them of B12 every single night. Stay with us, because that one is coming up first. Number 3. Proton pump inhibitors, PPIs. Proton pump inhibitors, or PPIs, are some of the most widely prescribed drugs in the world. You probably know them by names like omeprazole, pantoprazole, lansoprazole. These medications are designed to reduce the amount of acid your stomach produces, and they do that job very well. For people who suffer from chronic heartburn, acid reflux, or a condition called GERD, gastroesophageal reflux disease, PPIs can feel like a lifesaver. They bring real relief. The problem is what happens to your B12 absorption when stomach acid drops too low. Here's the science behind it. Vitamin B12 in the food you eat is attached to proteins. Before your body can even begin to use B12, stomach acid has to break those protein bonds and release it. Then a special substance called intrinsic factor, produced by cells in your stomach lining, has to grab onto the free B12 and carry it down to your small intestine for absorption. When PPIs reduce your stomach acid, that first step never happens properly. The B12 stays locked to its protein. Intrinsic factor can't grab what it can't reach. The result? Most of the B12 from your food passes right through you without being absorbed at all. A landmark study published in JAMA, the Journal of the American Medical Association, looked at over 25,000 patients and found that people who took PPIs for more than 2 years had a 65% higher risk of vitamin B12 deficiency compared to people who didn't take them. That's not a small number. That is a massive increase in risk just from a medication most people assume is totally harmless for long-term use. Another study published in the Annals of Pharmacotherapy found that between 30% and 40% of long-term PP users showed measurable B12 depletion in their bloodstream. For people over 60, this risk is even higher because stomach acid naturally decreases with age anyway, and PPIs push it even lower. What does B12 deficiency actually do to you? At first, it might just feel like you're tired more than usual. Then comes brain fog, that frustrating feeling where words slip away and concentration becomes hard. Then peripheral neuropathy, which means nerve damage, usually starting as tingling or numbness in the hands and feet. Left unchecked, this nerve damage can become permanent. There is also a strong link between low B12 and cognitive decline. A study in the journal Neurology found that older adults with low B12 levels had significantly faster rates of brain shrinkage, a physical measurement of brain tissue loss, compared to those with healthy B12 levels. If you're taking a PP, the most important thing you can do is ask your doctor to check your B12 levels with a simple blood test. Standard multivitamins often don't contain nearly enough B12 to compensate. Supplementing with methylcobalamin, the most bioavailable form of B12, in higher doses, typically between 500 and 1,000 micrograms daily, is often recommended. Sublingual B12, the kind that dissolves under your tongue and absorbs directly into your bloodstream, bypasses the stomach entirely and is one of the smartest choices for anyone on long-term PPIs. It is also worth knowing that some people on PPIs can still absorb B12 from high-dose oral supplements reasonably well, because at very high doses, a small percentage of B12 can be absorbed passively through the gut lining. No intrinsic factor required. This passive absorption pathway only kicks in at much higher doses, which is another reason standard multivitamins with their low B12 content aren't nearly sufficient. Talk to your doctor about the right dose and form for your specific situation, because what works for one person may not be enough for another, especially if you've been on PPIs for several years already. Now let's move to the second medication on this list, one that's been prescribed for decades and affects a completely different but equally critical pathway. If this is new to you, hit subscribe right now. We cover science-backed senior health every week that your doctor might never mention. Number 2. Metformin. Metformin is the most commonly prescribed medication for type 2 diabetes in the world. Hundreds of millions of people take it daily, and in many ways it's a remarkable drug. It helps control blood sugar effectively, it's inexpensive, and it has a strong safety track record. In recent years, there has even been research exploring whether it could have anti-aging properties. So when we tell you that metformin has a serious and well-documented problem with B12, we're not saying don't take it. We're saying you absolutely need to know what it does so you can protect yourself and stay ahead of a deficiency that could be silently building for years. The mechanism here is different from PPIs. Metformin doesn't significantly affect stomach acid. Instead, research suggests it interferes with a calcium-dependent process in the small intestine that is essential for B12 absorption. The cells in your ileum, the final section of your small intestine, rely on calcium to take up the B12 and intrinsic factor complex. Metformin appears to disrupt this calcium-dependent uptake mechanism, which means even if your stomach acid is fine and your intrinsic factor is working perfectly, B12 still can't get through. The evidence on this is striking. A study published in the British Medical Journal followed over 155,000 patients with type 2 diabetes and found that those on metformin had a 7.4% rate of B12 deficiency, compared to just 3.3% in patients not taking the drug. That means metformin nearly doubled the risk of deficiency in this large, real-world population. Another study in diabetes care found that after just 4 years on metformin, approximately 30% of patients show a measurable decline in B12 levels. The longer someone took metformin and the higher the dose, the more pronounced the depletion. What makes this especially dangerous is that diabetic neuropathy, nerve damage caused by high blood sugar, shares almost identical symptoms with B12 deficiency neuropathy. Both cause tingling, numbness, and burning sensations in the feet and legs. This means that a person with type 2 diabetes on metformin could be developing B12 deficiency neuropathy, but because it looks exactly like diabetic neuropathy, both the patient and the doctor might assume it's just the diabetes progressing. In reality, fixing the B12 deficiency could stop or even partially reverse some of that nerve damage. A study published in the journal Diabetes and Metabolism found that correcting B12 deficiency in metformin users led to meaningful improvements in neuropathy symptoms in a significant portion of patients. The American Diabetes Association now officially recommends that patients on long-term metformin have their B12 levels monitored periodically. If you've been on metformin for more than a year or two, talk to your doctor about getting tested. Supplementing with methylcobalamin or taking B12 injections, which completely bypass the absorption issue, are both highly effective options. One important note, Taking calcium supplements alongside metformin has been shown in some research to partially offset the absorption interference, which is interesting because it points directly back to that calcium-dependent mechanism. A small randomized controlled trial published in the Archives of Internal Medicine found that patients who added calcium supplementation to their metformin regimen had significantly better B12 levels after 2 years compared to those who didn't. It's not a complete solution, but it's a meaningful and easy step that costs almost nothing to implement. Up next is the number 1 medication on this list. And this is the one that cardiologists are now calling the most overlooked B12 threat for people over 60. Number 1. A2 receptor blockers. A2 receptor blockers, also called H2 blockers or A2 antagonists, go by names like famotidine, ranitidine, cimetidine, and nizatidine. These medications work by blocking histamine signals that tell your stomach to produce acid. They're often used for heartburn, ulcers, and acid reflux, similar to PPIs, but with a slightly different mechanism. And crucially, they are available over the counter. That means millions of people take them regularly, often every night before bed, without a prescription, without monitoring, and without any doctor ever checking their B12. This is exactly why cardiologists are raising the alarm. Because A2 blockers suppress stomach acid just like PPIs do, they cause the same breakdown in B12 absorption. The acid that's supposed to free B12 from dietary protein isn't there in sufficient amounts. Intrinsic factor can't do its job, and B12 passes through unabsorbed. The difference with A2 blockers is that because they're over-the-counter, people often don't think of them as real medications that could cause nutritional deficiencies. They pop a Pepcid before dinner and don't think twice. But the research says they absolutely should. A study published in the American Journal of Gastroenterology examined over 10,000 older adults and found that regular use of A2 blockers for more than 12 months was associated with a 40% higher risk of clinically significant B12 deficiency. A separate analysis in the journal Alimentary Pharmacology and Therapeutics confirmed that acid-suppressing therapy in general, both PPIs and A2 blockers, was strongly associated with falling serum B12 levels over time, with the effect becoming more pronounced after 24 months of use. For people already eating less meat or dairy, which are the primary dietary sources of B12, the combined effect can push deficiency into dangerous territory very quickly. The reason cardiologists specifically are concerned is that low B12 doesn't just affect nerves and brain function. It causes something called hyperhomocystinemia, elevated levels of an amino acid called homocysteine in the blood. Homocysteine is toxic to blood vessels at high levels. It damages the inner walls of arteries, increases inflammation, promotes blood clotting, and significantly raises the risk of heart attack and stroke. A major meta-analysis published in the Journal of the American College of Cardiology reviewed data from over 30,000 patients and found that elevated homocysteine was independently associated with a 25% to 30% increase in cardiovascular risk. B12 is one of the key nutrients that your body uses to break homocysteine down. When B12 drops, homocysteine rises. When homocysteine rises, your heart pays the price. This is why cardiologists caring for seniors are now specifically flagging A2 blocker use as a cardiovascular risk factor through this B12 pathway. The practical takeaway here is simple but important. If you take A2 blockers regularly, even just a few nights per week, your doctor needs to know. Many people never mention it because they bought it at the pharmacy shelf and assume it's harmless for long-term use. Get your B12 levels checked. If you're deficient, work with your doctor on a supplementation plan using methylcobalamin in sublingual or injection form. If you use A2 blockers for nighttime heartburn, ask your doctor whether dietary changes, timing adjustments, or a different treatment strategy could reduce how often you need them. And regardless of what you decide about the medication, supporting your B12 intake proactively, especially after 60 when natural absorption already declines, is simply one of the smartest things you can do for your brain, your nerves, and your heart. So there you have it. 3 extremely common medications: proton pump inhibitors, metformin, and H2 receptor blockers, all working against your B12 in ways that most people and even many doctors don't fully account for. The damage they cause doesn't happen overnight, but it builds quietly and steadily until one day the fatigue is too big to ignore, or the tingling in your feet becomes constant, or a blood test comes back showing levels that should have been caught years earlier. The good news is that this is preventable. Ask your doctor to check your B12. Know what you're taking and what it does. Supplement smart using the most absorbable forms. If you've been on any of these medications for more than a year and you've never had your B12 tested, that test is overdue. A normal serum B12 blood test is inexpensive and widely available, and some doctors will now also test for methylmalonic acid, a more sensitive marker that can catch early deficiency even before your B12 number technically falls below the normal range. The earlier you catch a problem, the easier it is to fix. Nerve damage from B12 deficiency, once it becomes severe, can take a very long time to heal, and in some cases, full recovery isn't possible. That's not meant to scare you. It's meant to motivate you to act now, while the solution is still simple. Share this with someone over 60 who takes any of these medications, because that simple conversation could genuinely protect their health in ways that truly matter. Now, we want to hear from you. Are you currently taking any of these 3 medications? And have you ever had your B12 levels tested by your doctor? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.